CPAP. Most of you have heard of it. Many of you probably wear one, but you might not know what it stands for and all of the ins and outs. So I wanted to do a video on that. Now, CPAP. CPAP stands for Continuous Positive Airway Pressure. So if you've ever worn one, you know that it literally is continuous positive airway pressure. Um, it is used to treat sleep apnea, and it is very effective at that. Now, in a hospital setting, this is just a side note, a CPAP can also be used for pulmonary edema. It will actually help push the fluid out of your lungs. So it can be used both ways. But some of the benefits that you would have with using a CPAP if you have sleep apnea is you're going to have improved sleep, you're going to have an increase in energy, you're going to have an increase in mood, focus, concentration, all kinds of stuff with the brain, okay, in a positive direction. And it's also going to help your heart health as well. So lots of good things come from wearing a CPAP. Now, the way that it works is it quite literally keeps your airways open while you sleep. So when you take a breath in and your lungs are open, and then you exhale, then you don't have anything left in there when you exhale. This is going to pretty much keep you in an inhale all night long, okay? So you're going to be, if you were to stop breathing, this, with that pressure, is going to keep that from happening. So you don't have to worry about that anymore. Now, that's with the proper settings. So obviously, you would need to make sure you have the proper settings for that to work like that. But it literally, so it will open up your airways, and it also opens up your alveoli, which are the little things at the ends of your lungs that it's where gas exchange takes place. So you're going to be getting the oxygen that you need into your blood. It's going to get to your brain, all of your muscles, and that's what makes you feel so much better the next day. Now, a lot of people will stop wearing their CPAP because it makes you feel claustrophobic or something like that. So there are different ways that you can kind of make it a little more comfortable. The first thing would be just not settling on a face mask. There are lots of them out there, lots of different brands made for comfort. You can get the full face, you can get the nasal prongs. There are so many. So if yours specifically is not comfortable, then find one that you can tolerate. On top of that, you can also adjust the humidification going into it. And you can actually just start off using it just a little bit, like a couple hours a night, and just progressively start wearing it longer. Now, some of the newer CPAP machines actually have a setting in there where it starts off on a low pressure, and then as you sleep, it gradually increases the pressure. So it's not as noticeable to you, but it still works really well. So if you do happen to have sleep apnea, then I want to very much encourage you to wear your CPAP every night. And that's really going to help you. It's going to help you get better sleep, but you're also going to have better health.